Menopause. Menopause is when a woman stops having her period. Menopause is when a woman stops having her period. It's a natural part of aging that usually happens to women between the age of 45 and 55, which is caused by which is caused as a result of a decline in the production of reproductive hormone, the estrogen and the progesterone. The estrogen is responsible for pregnancy in the female, whereas the progesterone is associated with maintaining pregnancy. We've got about 3 stages of menopause. The first stage is a premenopause, which is the transition period to the real menopause. Because menopause is a gradual process. It doesn't just happen overnight. It's gradual process. It's a transition process. In some women, menopause can start, the process of menopause can start from the age of 40, while some in their early 40s, middle 40s, or late 40s. So that process, that period, when the woman transits to menopause, when it starts to when the menopause sets in, is called the premenopause. When do we say that menopause has set in? Menopause is when a woman finally stops menstruating, seeing her period, for consecutively 12 months. In order to be sure, to be more precise, some will do a confirmatory test, which is when the follicle stimulating hormone is high. So we're going to talk about the signs. But before then, I will also mention induced menopause. So menopause can come earlier, which we say maybe it is induced. There are some disease conditions that can induce menopause. These disease conditions are autoimmune disease, surgery, which affects, or surgery of the removal of the ovaries, or accidents, injuries, cancer, chemotherapy, and the radiation therapies also induce, in some cases, induce menopause. Why often menopause is a natural process. It's a natural aging process in women. So I would like to talk about some signs that you will see, and you will now say, could this be premenopause? These signs are, at times, a woman starts seeing or observing that there's fluctuations in her menstrual cycle. Her menstruation skips for like a month, 2 months, and starts again. It's not infection, it's not any other thing. And this woman is between 40, in her early 40s, middle 40s, or late 40s. Some people can have this perimenopause for 10 years or 14. While some their perimenopause starts maybe in their late 40s and lasts for about 4 years. It depends on individual. So what are the signs we are going to look out for? These signs of perimenopause is when this period ceases and after 1 month, 2 months, depends, and it continues. It starts again, all over again. At times, the flow could be heavier or lighter. And when the flow is heavier and more heavier, try to see your healthcare provider. At times, it could be lighter, the flow. Then the frequency can as well be altered. These are the signs of premenopause. That does not mean that the woman who is in this transition, premenopause, can no longer be pregnant. Women in premenopause get pregnant and bear children as well. It's a transition process. So I would like to make mention of lots of signs and symptoms of menopause. We have something like the hot flushes. All of a sudden, a woman feels warmth without doing anything, any job, anything that might trigger that. Often is more in the head and chest region. We have the night sweat, whereby a woman is sleeping and this sudden heat that disturbs her sleep. Insomnia, disturbance in the sleep pattern. We have tiredness, fatigue, vaginal dryness, because the ovaries are atrophying, they are shrinking. There is a fluctuation, there is up and down in the production of the reproductive hormones. This actually affects the women. Pains while intercourse, mood swing, mood changes, irritability. Suddenly she becomes irritable at any slightest mistake. She feels irritable. Mood swing. She's happy this moment. The next moment she feels like crying. That's the fluctuation. That's the hormone. That's the hormonal changes. Body aches, shoulder tightness, headache, body pain, depression, tenderness of the breasts. Lots of things. If it's more than 30, and women have different signs and symptoms. I chose to speak about this topic because most of our mothers, we women, come to the hospital, complain. Lots of tests being done, no diagnosis. You just literally know that this is menopause setting in. Could be postmenopause, could be premenopause. So I try to talk about this. So we look about the signs and symptoms and actually know about it. Have these signs at our fingertips for every woman out there. So all these signs and symptoms must not happen to every woman. Some could experience 3 out of 8, 1 out of 8, and some women are very lucky that their signs and symptoms of the perimenopause, menopause, postmenopause are quite mild. Why some women, their signs and symptoms is quite severe. For women with mild signs and symptoms, there are some remedies, management, because there is no cure for menopause. There are some remedies. Eat healthy, more of plant food that contains magnesium, calcium, vitamin D. Eat healthy, go green, eat more of plant food, cut down sugars intake. Studies have shown that this is quite helpful. Regular exercise of about 30 minutes to an hour, is quite important for our general well-being as well. Vitamin supplements like vitamin D, which is very helpful for bones. Most of us, most of our mothers, most of women are prone to osteoporosis, arthritis, bone weakness, so vitamin D will be helpful. Then for women with severe signs and symptoms, you need to see your doctor. You need to see your healthcare provider. There are medications for hormone replacement. Get into your hospital. If it's that severe, you'll be assessed and prescribed and be given these hormone replacement medications for women with severe signs and symptoms. It's quite good and reasonable that every woman out there know and have this knowledge of menopause, premenopause, postmenopause. When our mothers, our parents complain, when you want to provide for your parents, you know what exactly you're giving them. Because there is a saying what that say, as we age, it's good we age with dignity. We age, it's good we our parents, ourselves, we age with dignity. So when we look after ourselves, when we look out for ourselves, it will be very, very good that our parents are aging with dignity because we have these informations. Our sisters, our elder sisters, our sister, ourselves, we get ready, we prepare our body for menopause, perimenopause, and postmenopause. Thank you all. Thank you.